You wake up in the morning, swing your legs out of bed, and the moment your foot touches the floor, a sharp, searing pain shoots directly through your heel. It feels like you are stepping on a burning nail. You go to a local clinic, and the doctor immediately diagnoses you with plantar fasciitis. They tell you the thick band of tissue on the bottom of your foot is inflamed. For the next 6 months, you follow their exact instructions. You roll your foot over a frozen bottle of water. You buy expensive, bulky orthopedic shoes. You endure agonizing cortisone injections directly into the bottom of your heel. But nothing changes. The burning electrical pain remains exactly the same. And sometimes you even feel a strange cramping sensation in your calf muscle. If you are experiencing this cycle of failure, you must stop treating your foot. You are a victim of a massive medical misdiagnosis. Your foot is perfectly healthy. You are suffering from a crushed spinal nerve, and today we will explain exactly why your doctor is looking at the wrong end of your nervous system. To understand why your heel hurts when the actual problem is in your lower back, you must understand the exact electrical wiring of the human body. Think of your spinal cord as the main electrical breaker box for your entire physical structure. The nerves that exit this box travel down your legs and act as the electrical cables that provide power and sensation to your feet. The longest and thickest nerve in the human body is the sciatic nerve. It is formed by several smaller nerve roots exiting the lower spine. We must focus on one highly specific cable, the S1 nerve root. This nerve root exits the spine at the very base of your lower back, specifically between the 5th lumbar vertebra, known as L5, and the sacrum. The S1 nerve cable travels deep through your buttock, down the back of your thigh, down the back of your calf muscle, wraps around your ankle, and terminates directly in the heel and the sole of your foot. If a mechanical failure in your lower back crushes this specific S1 wire, the brain receives a massive chaotic distress signal. Because the end point of that wire is located in your heel, your brain assumes your foot is being destroyed. This is called referred neurological pain. The appliance is perfectly fine. The short circuit is happening inside the breaker backs in your spine. This anatomical reality exposes why traditional foot treatments completely fail for this condition. When a local podiatrist or general doctor assumes you have plantar fasciitis, they focus entirely on the local tissue of the foot. They inject powerful steroids into the heel to stop local inflammation. They prescribe custom insoles to change the arch of your foot. But if the pain is actually a false alarm generated by a crushed S1 nerve in your spine, these treatments are a catastrophic waste of time and money. You cannot fix a crushed electrical wire in the ceiling by changing the light bulb on the wall. Injecting steroids into a healthy foot will only degrade your natural fat pad and damage healthy tendons. Stretching your foot aggressively will do absolutely nothing to relieve the mechanical pressure that is actively suffocating the nerve cable high up in your lumbar spine. We cannot solve this mystery by guessing. We must act as elite medical detectives to differentiate between true plantar fasciitis and spinal nerve compression. There is a very specific clinical pattern we look for. True plantar fasciitis is usually the most painful during the very first steps in the morning, but the pain often warms up and decreases as you walk throughout the day. Furthermore, the pain is strictly isolated to the bottom of the foot. If your heel pain is caused by the S1 nerve, the pattern is entirely different. The pain often gets worse the longer you stand or walk. The burning sensation does not stay isolated to the foot. It often radiates upward into the back of the calf, or you may feel a deep ache in your buttock. You may also notice that it is difficult to stand purely on your tiptoes because the S1 nerve controls the calf muscle responsible for that exact movement. When a patient presents with these symptoms, an elite neurosurgeon immediately abandons the foot and orders a high-definition magnetic resonance imaging scan of the lumbar spine. When we evaluate the lumbar MRI, we focus intensely on the L5-S1 spinal segment. This specific joint is the most heavily loaded mechanical pivot point in the entire human skeleton. Because it bears the maximum weight of the torso, the spinal disc at L5-S1 is highly prone to structural failure. We look at the axial, top-down view of the MRI to measure the exact millimeter of clearance around the S1 nerve root. We must determine the exact nature of the clamp. Is the thick, rubbery wall of the spinal disc bulging outward and suffocating the nerve? Has the disc completely ruptured, allowing a fragment of highly toxic, inflammatory gel to leak out and chemically burn the nerve? Or have hard, calcified bone spurs grown into the narrow tunnel where the nerve attempts to exit the spine? We map the exact millimeter of the compression. If the MRI shows a crushed S1 nerve on the right side of your spine and you have burning pain in your right heel, we have a perfect mechanical match. The mystery is solved. Because the heel pain is simply a false alarm caused by the lower back, our entire treatment protocol is focused exclusively on releasing the pressure in the spine. If the MRI proves that the compression is caused by a contained soft disc bulge at L5-S1, we bypass open surgery entirely. We utilize ultra-minimally invasive techniques like percutaneous laser disc decompression. Under local anesthesia, we guide a microscopic laser fiber directly into the failing spinal disc. We vaporize a tiny fraction of the internal pressure, creating a vacuum that pulls the bulge away from the S1 nerve. If the compression is caused by a massive ruptured disc fragment or hard bone spurs, the laser is obsolete. We use advanced endoscopic spine surgery. Through an incision smaller than a coin, we insert a high-definition camera directly into the spinal canal. Using microscopic instruments, we gently remove the disc fragment or shave away the overgrown bone, physically freeing the trapped electrical cable. The moment the nerve is released, normal blood flow returns. The false electrical signals stop, and the terrifying stabbing pain in your heel permanently vanishes. Many patients live with severe, burning foot pain for years. They accept the agonizing daily routine because they trust a doctor who never bothered to look at their spine. They spend thousands of euros on custom orthotics, painful shockwave therapy, and repeated steroid injections that slowly destroy their heel tissue. But let us look at the true cost of getting this wrong. If you ignore a severely crushed nerve in your lower back, it will eventually suffer irreversible damage. The S1 nerve will begin to die from oxygen starvation. You will permanently lose the strength in your calf muscle. Your foot will go completely numb, and you will develop a permanent limp. You are risking lifelong neurological damage because your doctor is treating the wrong end of your body. For a fraction of the cost of useless foot treatments, you can have an elite neurosurgeon review your spinal imaging, potentially saving your nerve and ending the pain immediately. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution, but you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comment section. If you have an MRI of your lower back, do not just read the paper report. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, trace your pain back to the exact source, and build your personalized, minimally invasive treatment plan. Stop living in pain and stop treating the wrong anatomy. Let us find your solution today.